I am Dr. Kate Utek with New Journey Physical Therapy. My office is located in Highland Park on the North Shore of Chicago. I'm a board-certified clinical specialist in women's health physical therapy, specializing in treating people who are pregnant, postpartum, or experiencing pelvic floor dysfunctions. Right now I want to talk to you about poop and pooping positions. So I'm going to go through a little bit of anatomy to give you a sense of why I'm making the recommendations I am. This is a rectum, okay? This is where poop is stored briefly as it comes down from your colon into your pelvis. When the rectum fills, your brain then gets a signal to say, hey, please get to the bathroom because I have some stool that needs to be evacuated. So when we put the rectum into the pelvic model, it rests against the back of the pelvic floor, and you can see it against the back of the sacrum. Comes out through the anus. Your pelvic floor muscles are mostly responsible for maintaining fecal continence and keeping stool in. So you have your external anal sphincter, which is the primary muscle assisting in this function. And then you have your other pelvic floor muscles stabilizing and providing some assistance to make sure that you stay continent. So this portion of the rectum goes out the anus. And you see how it's bent. This is the position it's in through most of our day. This is the position it's in when we're out walking, lying down, sitting on the couch, driving in the car, sitting at the table, exercising. This is where it is. But that's a bend, that's a kink. When it rests in the pelvis, it is bent to create, just like if you were to take a hose, a bend in the hose where the water can't get past, making it so that stool cannot get past this little bend and you don't end up with stool in your underpants. That is created mostly by the puborectalis muscle, which goes from the pubic bone in the front along back and around the anus, around that lower part of the rectum, and pulls it forward. I know it's really hard to see inside of my pelvis. I'm trying to find an angle. So it comes from the pubic bone in the front here, back, and comes around the rectum and back up the other side. And it pulls forward on that rectum, creating that kink. When we go to defecate, to have a bowel movement, you want this muscle to relax. Allowing this muscle to relax means that that rectum straightens out and you take the kink out of the hose. You now have a straight shot so that your colon contractions can easily push stool out of your body through the anus. So that is why the squatty potty was invented. I'm getting no money from the squatty potty manufacturers, and in fact, I don't specifically endorse them. It is a great product. I do recommend them if that's what works for you and your toilet, but it's based on your anatomy and your toilet size. Your size and your toilet size. So, and how your unique anatomy may factor in there as well. When you are sitting on the toilet, you want to bring your knees up so that your hips are at a 30-degree angle, because that's going to allow the puborectalis muscle to relax and allow that rectum to become a straight shot down to the anus. So I'm going to show you what this looks like without a squatty potty, because it doesn't have to be a squatty potty, it doesn't have to be a specific stool, it can be anything. Today with the chair behind me, because that's what I can easily get set up for a good angle for this video, is a box. And I can use a box, and I'm going to demonstrate a good position. So you're going to come sit on the toilet. You're going to bring both feet up onto your chosen surface. By bringing my knees up, but keeping my feet flat, I'm able to relax through my pelvic floor. My knees are high, and then I tip forward. I'm not coming forward through my shoulders and upper back. I'm coming forward through my hips, just this. My feet are wide, my knees are wide, and my elbows rest on my knees so that I can breathe in and feel my pelvic floor relax down and out. In this position, I can easily give a little bit of a gentle bear down by breathing in and then maintaining a hard belly while exhaling to just bear down slightly and help my colon get started. But my colon should be able to do most of the work itself. It should not need help of bearing down hard and straining to get that bowel movement out. In this position, you should be able to sit down and easily have a bowel movement on your own. Hopefully that gives you a little help, especially if you've been having some constipation, to get those bowel movements out a little more easily. Thanks for watching.